Thank you very much, Mr. Chairman, and let me, along with the rest of the members, echo your new aggressive leadership and what you're doing in terms of veterans. I really respect the team that you brought in and this more business-like approach to what is an incredibly important issue for veterans in my state and across the country. And let me thank you, too, for the constructive dialogue we've been able to have moving the VA forward as you near the end of your first year as secretary. As we discussed during last week's visit, New Mexico's key issues can be narrowed down to ensuring that veterans have access to care. Too often, veterans are prevented from receiving the care they deserve because of barriers to access. Starting with disability claims, many veterans are not able to have their claim adjudicated in a timely manner. In New Mexico, progress to reduce the backlog is stagnated, and that's this chart I have behind me here. I think I've showed you that before, where we've come down dramatically. We've made good progress, but it's stagnated, and I'm hopeful we can get the resources to make progress in reducing the backlog once again, and where it's stagnated, started in a downward turn. With regard to scheduling and the scheduling issue around the Veterans VA, last summer showed we had a lot of work to do to ensure that veterans are seen on time and that the scheduling system was not being utilized in a fraudulent manner. As I mentioned, I asked the VA OIG to look into this matter, and I'm awaiting their findings. Furthermore, for rural veterans in New Mexico and across the country, we need to do more to find creative solutions to the recruitment and retention problem facing the medical community in rural clinics. This is not something that is solely a VA problem, but I believe that it is an area that VA can take a leadership role to address. Based on the budget requirements and the VHA's experience, which would be the best way, and this has been mentioned by several questioners here and in some of your answers, which would be the best way to improve access to quality care, an expanded fee-for-service program, or a program which aims to recruit and retain rural physicians and nurses at rural CBOCs, and which helps to expand telehealth, and which would be the most cost-effective way for the American taxpayer? I know you've given this a lot of thought.
Well, sir, I think we need to do both. We envision a system in the future which is a combination of VA care and community care working together in a network to make sure our veterans get the care that they want. I'd like to briefly comment on your chart.
Please.
I think if you back the time period up, you'd see a more dramatic decline in the claims backlog. And also
Go back a couple of years?
Yes, sir.
Yeah.
And I also think the reason it leveled out was we had 660 additional headcount in the Choice Act for Veterans Benefits Administration because we have been working mandatory overtime in Veterans Benefits Administration to drive this backlog down to zero. As I was going around doing town halls amongst the people in Veterans Benefit Administration, I was seeing increasing, not surprisingly, increasing conflict between labor and management. Mandatory overtime is not the way to run a business. That 660 people were stripped out of the Choice Act before it was passed. You did not give us, you, Congress, did not give us those people. We took off mandatory overtime hoping we could continue to drive it down. That straight line is when we took off mandatory overtime. It didn't work. We had to put it back on. So we're still doing mandatory overtime, which we've been doing now for several years, which is not a good idea. We've got more people in the 2016 budget that we need in order to get the backlog down. We're going to get to zero by the end of the year, but we need those people. Also, I think there's a couple of months that are not on your chart. Danny, could you update us on that?
Yes, Senator. First of all, great chart. Your numbers are dead on. You did a really good job on it, your staff.
We should say we publish our numbers every 2 weeks. So we want to be transparent, and we want you to know what our numbers are.
And we appreciate that.
But as we went back into mandatory overtime, we started pushing again. You see the dark orange where that's your number pending. That has now come down. And because that has come down, as of right now in April, You're down to 40%, 47% in the backlog, 3,500 claims pending, and 1,500 of those claims in the backlog. You will see the continued downward slope that you saw earlier in your chart for the next 3 months, and a huge drop-off this summer, because pretty soon, every claim we're going to be working is going to be in the backlog. And that won't be just for your state, that'll be for the entire nation. We should have zero backlog this year.
Maybe I can ask Carolyn to comment on telehealth, because this is a really important strategy for us.
I've run out of time. Just if you could just very briefly, Carolyn.
I would just simply say that New Mexico is really a model, with Dr. Aurora at the University of New Mexico working closely with us. This is a matter of, if the veteran can't come to the medical center, then we can use telehealth to bring that expertise to the clinicians working out in the rural communities. And it's worked phenomenally, and we're actually using it in other parts of the system as well.
Thank you very much. And Dr. Aurora, he's pretty amazing. Thank you. Thank you, Mr. Chairman. Thank you for your courtesy.
Capito.